This is Dr. Schultz at the Centeno-Schultz Clinic. I want to thank you for checking in today. We're going to be talking something that's central to you, your patient practice. In 2005, we started utilizing stem cells and platelet therapy for a myriad of different conditions. And this month, what we want to focus in on is kind of the core, the low back. We all suffer from that time and time, and some people absolutely get sidelined. So let's take a deeper dive into what we look at. Now, unlike many of the medical practices, we don't have blinders on. In fact, we look at the spine as a functional unit. That's right. What are the different components? There are many. So there's the disc, which is the spongy component in between the building blocks. Then there's the facet joint, the joints in the back. They're right here on each side, and they can be a source of pain. And then there are the ligaments, basically the duct tape that connects all the bones together. And then we can't be remiss if we don't talk about the fascia and, of course, the sacroiliac joint. We look at it all, and we also look at the cervical spine and how it ties in to the lumbar. So we have a much more global approach, and we think that with that global approach, patients get much better clinical outcomes.
I like it. Dr. Schultz, thank you for coming on today. I'm super pumped to talk down low back. I know our smart chiropractors have been jazzed to have you come in. Clinical Conversations is a new benefit that we are offering to everybody in this group, where we're going to bring on docs like you, MDs, DOs, DCs, all collaborating, communicating, getting a better understanding of how we can work together to help people live higher quality life with better results. You have a super interesting take on all this. You've been at the forefront. We wanted to start with you to really get deep dive into causes of low back pain, why movement's so important, ultimately how people are taking care of this in a modern context. We talk about it with patients all the time, and we say, man, the days of bed rest and surgery as the only option, or medication as the only option, those are out the window. This is about function, as you described. Movement is so critical and essential with that. Before we dive in, I also want to kick it over to Smart Chiropractor co-host here, Jason. Jason, how are you doing today?
I'm doing great. I got to tell you, I'm really excited for this new benefit for the smart chiropractors out there, hundreds around the world. Dr. John Schultz is really besides a great friend, one of the world's foremost experts, who's a medical doctor who understands the chiropractic perspective. And that is just rare and a treasure to have. I know it's no secret to chiropractic. There's been, let's just call it a major miscommunication between our profession, medical doctors, and medical doctors in our profession. There just haven't been enough of us that sit down, break bed, have conversations, and focus on what's most important, which is helping people with their outcomes. And Dr. John Schultz is part of the Centeno-Schultz Clinic, which is really known to be the world's foremost expert in regenerative medicine, also known as orthobiologics. Some of you may have heard this when you hear things like PRP or stem cells, but we're specifically talking, and this is one of the major reasons we're doing this show, is to dispel the myths, to be able to actually speak accurately and I'll dare say legally about what stem cells are and what stem cells aren't. The overwhelming majority of chiropractors who talk about stem cells are often doing them illegally. And so I'm making that statement from the get-go that this isn't just another way to try to get chiropractors to talk about stem cells that are illegal, which is the way most are doing it, but it's a way to understand that certain ways of treating people with stem cells are both legal and appropriate. And the main factor that we're bringing here today is should be done by the experts who are trained in doing that. So just like chiropractors would hate the idea of other professions providing adjustments or manipulations or other types of care you think you're expert at that you wouldn't want them to take a weekend course at. Imagine that the same thing applies to us here and now. So we're setting the record straight. We're saying, yes, autologous stem cells, meaning coming from your body, done by the world's foremost trained experts, can be a great solution for those people that come to you for help that may have waited too long or have injuries that are more significant than what adjustments are able to help them with. Those people that basically are candidates for surgery should be candidates to be looked at by one of these, what I'll call conservative medical doctors, doctors of osteopathy. John, let me start off also by asking, I don't want to get clinical. I'm a big fan that people care more about the messenger before they appreciate and respect the message.
Sure.
Maybe just spend a brief moment sort of describing, what makes you unique amongst the medical profession.
Sure.
How do you think differently than the other medical doctors out there that we know? And I think all agree, oftentimes put profits over people, oftentimes don't follow the science and rush to do what they'll call standard of care, what we'll call the ineffective procedure covered by insurance that oftentimes makes people worse. I don't know how else to call a spade, but that seems to be what it is. Share with people, why are you a different kind of medical doctor than many of us have read about that just simply tend not to appreciate what chiropractic is, tend not to refer to chiropractors when they should be referring often? Why are you different and unique than most of the others?
Well, first and foremost, Jason and Jeff, thank you for this opportunity. I am very excited, and I think this is a huge win for the community at large. Why am I different, and why is the Centeno-Schultz Clinic different? First and foremost, I have been a patient. I have had the crippling pain where they had to literally lift me from the floor, from the bed, because I was in such severe agony. I have personally undergone these procedures and not surgery. So I can tell you firsthand what it's like to have a knife in your back and unable to straighten up. So that's first and foremost. Number two, I'm board certified and double boarded in both anesthesia and pain. I've had 2 fellowships, but most important, and I do mean this is not a Monday, Tuesday job and I do Botox and filler on the other days and I do high dose steroids. I can tell you categorically, with passion and I mean, absolute feeling, this is a life vision. This is what everyone in this practice does from the minute they wake up at 5 a.m. until the time we go to bed. This is not a fleeting thing. This is a passion that we will pass on the baton to the next generation, because in doing so, we can change lives and people's whole well-being. The days of taking things out because that's the surgical model have and must stop. And that is part of our mission. How do we provide incredible compassionate care and do a different model? We've been on that path, and it's been a long path, 15 years. And the third thing is failure has been our friend. Now, failure for many people, they just pack up and go home, but we just brush off the mud, we learn from our mistakes, and you know what? It went to the next level. So that's how we are uniquely different. And then the last one is we actually enjoy working with chiropractors and other professionals, because there are cases that we can't quite get the traction that we need. And we always refer back to those providers. So collaboratively, if we can change one patient, then we can change a family. If we can change a family, we can change a community. If we can change a community, we can change the entire vision of healthcare.
I love it. Thank you, John. Thanks for breaking that down. Let me ask, I'm going to dive in a little bit clinically, because I think you brought up some interesting components with what you just described. And I'm going to lay out a broad statement, and then we can dive into some of the details. Low back, do you find that the challenges reside mostly with hypermobility or hypomobility? And with the ligaments and how you address it, how does that play together?
Sure. So we have, because of our commitment to the patients that have cranial cervical instability, have attracted on a worldwide basis patients with some degree of hypermobility, right? And so the medical community, for the most part, does muscle strengthening for those patients that are hypermobile. But what if you could actually address the ligament stability? Back 10 years ago, we actually pioneered and mastered the healing of the anterior cruciate ligament, a critical ligament. Well, we have those same skills to do virtually any other ligament in the body. You can see these under ultrasound. So we actually inject them. These ligaments that are either stretched or partially torn can, in many cases, be treated successfully.
That's great. What's the gold standard of imaging? What should maybe some docs out there be looking for if they think a patient might have hypermobility? What are some of those clinical telltale signs?
So the first one is just the clinical sign, right? I mean, if you put their hand down on the table and they bring up their finger, and you can see how stiff mine is. Most people that are hypermobile go to like this. Or if they take, their thumb and they come back, they can come actually all the way back. They can hyperextend their elbow and off of their knee, and they can actually touch the floor. I can barely touch my knees. So those are the clinical ones, right? And you have to think and you have to treat those patients differently because they are not going to hold adjustments. They're going to have lots of other problems. And oftentimes for us, simply treating those ligaments can be life-changing.
Gotcha.
I had a patient recently who was so unstable, was so incredibly unstable that she would have dislocation of her shoulders and knees and was rendered to a wheelchair to go to fifth grade. Fifth grade. Can you imagine? But they flew over here from Europe, and I'm happy to say that she's now sledding down a hill and back in class and back with her friends, and will be attending swim lessons this summer. So change can happen.
That's fantastic. So when you think about a ligament and there's hypermobility in a joint, I guess how does stem cells, how does it kind of work? So you're identifying the ligament that is structurally supposed to be holding that joint together. You're injecting into that. How do you consider a treatment plan, and how do you get the success that you've seen?
So we use a combination of history, physical examination, and a really important factor is ultrasound. So most ultrasound is done statically. They put it down, but what we do is actually test and under various different pressures. And we can see, for example, in a knee joint or an ankle joint, we can actually see the ligament stretch, or gapping. So we target that with a needle under ultrasound guidance. Obviously, X-ray is not going to work because X-ray only shows us bone. And so we have all different probes on our ultrasound machine, and we can see deep, we can see shallow. And once you can see the specific ligament, it's very easy with our staff to get a needle in there and either use platelet therapy, your own platelets that we've super concentrated, or bone marrow concentrate that is rich in stem cell and other factors. And the bracing is equally important. So these are not magic pixie dust. It's a team effort. You got to identify the problem, identify it visually, treat it, and then brace it.
Great. What's the difference for a doc out there? And this was, Jason, I'll speak for both of us here by saying, when we first met you, a lot of the terminology was new to us. So break down a little bit of what does PRP mean? What is what are the differences between what you described, the bone marrow aspirate? Break down some of the differences at a high level, because I think that's important for docs to understand, because I think all of us as docs, we've seen patients that have come in and said, I've been recommended this, that, or the other thing. And just having some baseline information will be able to help us best direct. So what does it all mean?
Yeah. So we have many things in our regenerative toolbox. One of them is PRP. PRP is just platelet-rich plasma. So the platelets are those things when we shave, if we cut ourselves or if we're out bouldering and we injure ourselves, it's those little things that form the clot. So those are the platelets. And the keys to the platelets are they are incredibly rich in these little nuggets. And those nuggets are growth factors. And there's a large number of growth factors, but for simplicity, I'll just bring up two. There's one that actually increases the blood flow to an area. So think about it. Increasing a blood flow to a meniscus that gets pretty poor blood flow is like water to a garden. It's incredible. So that growth factor has a name. It's called VGF. vascular endothelial growth factor, works great. The other one actually decreases inflammation, and we coat usually nerves. So if you have a patient, for example, just with intractable median nerve carpal tunnel, we can actually we can identify the nerve and then bathe it with those growth factors in an effort to decrease the inflammation and improve the blood flow. So PRP. Now the problem is PRP outside of our clinic is standardized. That's to say, you put it into a daiquiri mixer. First off, you draw blood. You put it in a centrifuge, which is basically a machine that spins. You turn on the on switch, and presto, you get your one size fits all. But the problem, Jason and Jeff, is we all know as clinicians that patients are not all the same. Patients come in different sizes, with different medical conditions, with different ages. And that's so important for clinical outcome. So at the Centeno-Schultz and part of the Regenix network, we can customize. That's right. We can actually adjust the concentration of the platelet-rich plasma for the indication in the patient. So it's a customized platform.
That actually applies. Your language applies so much to what we do as chiropractors, and that's what I hope to do is sort of really highlight our synergies and the things that really make sense in our parallel. In chiropractors, we would say things like, there's no one adjustment that's for everybody. The more specific it is, the more effective it will be. And so your use of terminology, I think, is fantastic. John, I think one of the biggest confusing things for I'll say most medical professionals and therefore consumers is this difference between legal stem cells and illegal stem cells. Yep. So I know this applies to all joints, all body parts, and so on. But just to sort of clear the air, set the record straight.
Yep.
For you in terms of what you do, and for us, because again, people make assumptions. Chiropractors are thinking, oh, Jason and Jeff are now promoting stem cells. Yeah. But what we're promoting is understanding when orthobiologics by another medical expert is appropriate for your patient so that you can co-manage people for their best outcomes. Right. And I just want to briefly say why that's important and then ask you to explain the difference. But the reason it's important, and this goes to both sides. I know we've had conversations with the medical side of the equation, and we certainly have plenty of conversations on the chiropractic side of the equation. If we don't give patients our guidance about where else they should go. So if a chiropractor has a patient that is a potential surgical candidate, and if the chiropractor doesn't guide that patient to the right type of professional, the likelihood is they're going to follow the path of their insurance. They'll likely get to a surgeon. The surgeon will likely recommend surgery, and they'll oftentimes be down an irreversible pathway that sometimes is worse than the reason why they started or went for surgery to begin with. So we know from your perspective, when chiropractors are able to take clients who are surgical candidates and go, before you go that irreversible route, check out these conservative approaches that may help you reduce your risk of needing to live on opioids, needing surgery, all the rehab that goes along with it. We're doing patients and people the best care we can provide for them. That doesn't mean chiropractors should be trying to make extra money doing something illegal. No. Help me break down from your perspective what you know to be the differences for all the chiropractors that hear the word stem cells and have some sense of, no, I wouldn't do that, or yeah, that's a great way to make extra money, versus what you know stem cells to be and sort of the misperception of what's out there in the community. Help set the record straight for everyone.
Sure. And so thank you very much. I speak from a position of extensive experience. In fact, our clinic in 2005 was the first place in the world that injected bone marrow-derived stem cells into the L5-S1 disc. So for the last 16 years, we have been working intimately with bone marrow and regenerative therapies. That being said, there are three principal types of stem cells, if you will. The first is which it comes from bone marrow. So This is the iliac crest. We actually, and if you ever have leukemia or have this or any other hematologic problem, oftentimes there's a bone marrow transplant. A needle is put into the iliac crest, and through this we aspirate bone marrow. Okay, that's the first type of stem cell. It's the most well studied, and that the most, if you go on PubMed, that's where you'll see most of the literature. The key with this is it must be injected within 24 hours, same day. Has to be injected same day, and it's centrifuged down.
What's the time? Why the timeline, John? Why the timeline?
The timeline is in guidance with the FDA, who we have worked with extensively, and you cannot manipulate the bone marrow. You cannot grow it. You cannot enhance it. All you can do is spin it down and then concentrate it and re-inject it within that. So those are the guidelines to stay within the legal boundaries, okay? Number 2 is the fat. Fat is rich in stem cells. The problem with fat stem cells is there's a stroma. It's basically a fiberglass network that binds those cells. They are bound. There are a couple techniques out on the market where you mechanically try to break it up. It doesn't work so well. Or you can use an enzyme and cleave the fat from the stroma. That's illegal. That will take you to the attention of the authorities. Third, there's being marketing around these birth tissue, amniotic fluid, Wharton's jelly. These are products that are not an individual's, but are collectively a pool or someone else's. They have no living stem cells. There's high-level evidence, both at the University of Sacramento, both at Syracuse and University of Colorado, there are no living stem cells. They may have platelet growth factors, but there are no living stem cells. So, bone marrow-derived stem cells is the standard of care. That has the most publication, and that's what we use extensively.
Gotcha. When you talk about the stem cells themselves, I'm going to get basic. Maybe I'm going to call it basic and technical at the same time. So, what's the importance of the stem cell? What does it do? What makes it special? As you kind of said, hey, in bone marrow, we're able to really centrifuge down, get a concentrated, aspect of stem cells that are live that we can get back in that start action within 24 hours. And on the other side of the spectrum, as you said, man, there's some of these canned products out there that really don't have anything live. I guess I'll ask you straight up, why does it matter? What's so special about the stem cell, and what does it enable the body to do in a healing capacity?
Well, first and foremost, you have to be transparent with your patient and their family, right? If you're trying to sell them or advise them that we're going to do stem cells, and you're giving them a product off the shelf, right? Let's say you take this product off the shelf, and you reconstitute it, there are no cells in there. So honesty, integrity come first and foremost in this clinic when we're dealing with families and individuals. Number 2, bone marrow-derived cells have the potential of differentiating into different tissue, bone, cartilage, ligament, disc. So it can help heal by differentiating into those cells. Case in point is you have an ACL tear. Okay, you have a tear. And what can happen? The bone marrow-derived cells can go in there and actually close that gap by differentiating into those cells. If you sell them or tell them that you're going to do something else, and the cells that don't have that capability, you're not being honest. And most importantly, they're not going to get better. So it's absolutely important to understand that bone marrow-derived cells can differentiate into different tissue, and in doing so, heal them.
I gotcha. And this might be an obvious follow-up to that, but how does the growth factor play into that? Is it a necessity, the growth factors along with it? Do they come part and parcel to it when you centrifuge down? How do the growth factors work and interact with the stem cells?
They enhance them. They work in synergistic ways. I mean, just like every garden that needs to grow, what does it need? It needs water, needs sunshine. So they work in conjunction with each other, and it's a synergistic effect. In fact, our process, we implant the cells on a given day, and 2 days later, we come back and inject additional growth factors to kind of fertilize the cells that we've implanted.
lay out for chiropractors that are new to this, right? We know that there are some chiropractors that I'll just blatantly say are more concerned with, profits over people. I don't know how else to say it. And so some have taken it upon themselves to sort of set up something so that they can provide through a nurse practitioner or something, one of these products.
Yeah.
Again, I'm clarifying the difference that a product, according to the FDA, has no live stem cells, and therefore it's illegal to call them stem cell treatments.
Correct.
Even though it's happening, even though everybody goes above 55 miles an hour, if you get caught, it's still illegal.
Yeah.
So with that said, I want to make sure people keep on understanding the difference between the two. Help people, get a picture for your vision for, we're talking about being the best clinical value to real people who need real results. And I know we've talked about sort of what we refer to as the conservative care continuum, so that if people come to you and it's still too early, you don't just go, sorry, we can't help you. You go, okay, your injury isn't bad enough yet to be a good candidate for this type of procedure. We recommend you go see a fill in the blank type of professional. And just like chiropractors go, hey, listen, this may require an additional procedure that's above and beyond really the window that we're best at helping you with. We should refer you to others.
Yep.
Help everybody sort of get to know you by getting a sense for your philosophy on when do you believe people should see a chiropractor? When do you actively refer? I know you mentioned that a referral to you because of professional respect means a referral back to the referring doctor. And that's an important part of our culture, is that professional courtesy or respect. But help people get a sense for, you are one of those medical doctors that loves chiropractors and works well with them regularly. And I'll just sort of say for most chiropractors, we know that there are plenty of MD-DC relationships that go well. And I say that specifically because they best help people, not maximize your revenue, but because together we can co-manage people at different levels in that ladder, best for people's outcomes. What's your philosophy on all of that would give people a better sense, chiropractors a better sense of, okay, it's cool and safe to refer to you?
Yeah. So first and foremost, it's about integrity, just like with the injections, right? We're individuals, we're physicians with our word and our integrity on the line. We work diligently with other chiropractors. We love the skill set that we can't offer, right? And so if our patient comes in and really needs a chiropractor, needs someone after the injection, or maybe even before the injection, that's our go-to. Again, we are committed for best clinical outcome. We want to use a group approach. We're not interested in maximizing our profit. We're interested in the best clinical outcome so those individuals, their family, the community at large can get better. So we never keep a patient. We always refer back. And oftentimes, we are a procedural-based office. I guarantee you that our patients need follow-up with hands-on that the chiropractic community can absolutely help us with. We don't have that capacity. That's not with us. So we use that as much as possible. And then, like you said, if someone's not quite where they are and we want to exhaust conservative therapy, hey, that's an easy referral to our good friend across town or in that patient's community. But I also wanted to bring to the point is, those patients or those providers that are hiring a nurse. Can I speak to that for just a minute?
Go for it.
So I have spent the last 30 years of my life doing procedures with patients. And every procedure is done either under x-ray or ultrasound or both. And it takes an immense amount of skill and dedication and persistence almost to get a needle into the exact area. And you need that. You can't have a blind injection with going like this. You need to be fully committed to being able to hit all the different, or inject in all the different structures. A nurse practitioner, respectively, and a PA, respectively, while they're fantastic, lack that 10 years of practice. And so for those providers that are listening, I would just ask, give us a chance. Let's see if there's a difference. And if you want to come in, here's also an offer. If you want to come in and watch us, if you want to see whether we're really telling you the truth, come in. We'd love to have lunch, break bread, speak about how we can synergistically work together, and then let us demonstrate actually what we do, why we do it, and the patient's response.
I love it. Dr. Schultz, we really appreciate you coming on. We're going to drop some links down below for tools and resources so that docs watching this can reach out to you. We're going to drop a book down below, Orthopedics 2.0, that really lays out a lot of what we discussed and much more in great detail. We'll drop those links down below, and I'm also going to encourage all Smart Chiropractor group members who are checking this out. Stay tuned. Clinical Conversations is going to be an ongoing series of conversations. So on the next episode, if you want to bring a tough case, if you have your own questions about what's going on, we're going to open things up for question and answer. We're going to bring in some of Dr. Schultz's colleagues, and I'm sure he's going to be back on the channel. We appreciate the forthrightness. We appreciate the ability to have these conversations, better understand where are the lines, where can we refer, how do we get a better understanding of what everybody on a team is doing so that we can help the patient receive their best quality of life, their best results, and ultimately be happy and moving forward in the best way possible with as little intervention as possible, which is ultimately the goal. Jason, I'll throw it over to you to wrap it up as we close shop.
Yeah, no, I mean, listen, for all of you smart chiropractors watching, whether you're members now or members of the group, this is what we hope to bring you more value in the future. Having the ability to, from the convenience of your phone or computer or wherever it is, as Jeff said, ask about your own personal cases if you want to, ask about your toughest clinical cases in your practice. If you want access to, I mean it when I say, the world's foremost experts, the doctors who literally invented this stuff. If you want access to their minds, their resources, we are saying this is not a good business model for you. This is not to generate more money for you. This is to give you access to experts. And our goal is to have a monthly clinical conversation about this month's topic or whatever topic of the month it is, so that we can get smarter ourselves. We can become smarter doctors, smarter clinicians. We can have the resources we need to better help the people who are coming to you for help. And in many cases, you can help them. And in some cases, they need extra assistance in other places. And we just believe the smartest thing you can do is get people to the place that's going to give them the best help. And if you can't help them or you need to co-manage, oftentimes you wonder, where do I send them? What do I do? I say that on both sides. We're working on the medical side too. Where should we send them? What should we do? And what Jeff and I are building here is a directory and a communication opportunity for us to get to know each other, for chiropractors to get to know osteopaths and medical doctors. Everybody stays in their lane. Everybody appreciates what the talents are of each other's skills. And collectively, we can know that when we focus on really doing the right thing for the person who is coming to us for our expertise, when we can help them, we help them. When we can refer them to people who can help them and know that we co-manage and then stay co-managing that patient, we think that's the future. We hope you'll join us and we'll build some momentum. Bring your cases, bring other doctors, bring other colleagues. We think this is a revolutionary type of opportunity for the profession, which is why we're doing it. We hope you see value in it. If you're watching the replay, leave your questions, leave your comments. Let us know you're watching, and we'll see you next month with next month's topic, more clinical conversations. We hope this is the beginning of something really super special for everyone.
Have a great day, everybody, and thanks, Dr. Schultz. We'll see you soon.
Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.